Hi.
I'm Cathy Lewis, and I'm a graduate nurse practitioner student, and I'm going to be doing a head-to-toe assessment on you today. Do you know where you are?
Yes, ma'am. I'm at the student health clinic.
Okay, and if I could have your full name and your date of birth.
Lourdes Johnson, 9/15/52.
Okay, let me just wash my hands and then we'll get started. Okay, so I'm going to start by touching you, and I'm going to need to touch you in different parts of your body today to assess you. So if you feel uncomfortable, let me know, okay? I'm going to start with your head, okay?
Okay.
All right, so I'm assessing the scalp. The hair distribution is normal. The scalp flows freely over the skull. No abnormalities. The skull is symmetrical and even. Any pain on your head or your skull?
No, ma'am.
Okay. And the scalp appears healthy. No dryness or flaking noted. I'm going to touch your temporal arteries now. They appear normal. I'm going to go behind your ears and I'm going to start palpating your lymph nodes, okay? Any pain when I palpate?
No, ma'am.
No swelling or tenderness noted. Lymph nodes appear normal. Any pain there?
No, ma'am.
Okay. Now, if I push against your head, if you could push against me, okay? I'm going to test for strength of the neck. Okay. Equal bilateral strength. I'm going to touch your eyebrows. Eyebrows are even, equal, bilateral. I'm going to touch your eyelids now, okay? If you could just close your eyes. Do you feel any pain when I touch your eyes?
No, ma'am.
Okay. And I'm going to have you look up, okay? Conjunctiva, look pink. I'm going to touch your temporal mandibular joint now, okay? I'm going to put a little pressure. If you could open your mouth and close it. No popping or locking noted of the jaw. Do you have any pain when I feel there?
No, ma'am.
Okay. I'm going to move on, and I'm going to assess your eyes now, okay?
Okay.
If you could start off by doing a quick sharp up. Okay, and then again. Okay, and then I'm going to have you move your neck down and your neck up to the side, If you could roll, okay, and then roll the other way. Okay, and then could you just very gently close your eyes? Okay. No tics noted, no fasciculations noted. All right, and then if you could close your eyes very tightly. Okay, and then open them very wide. Okay, thank you. All right, now I'm going to look in your eye, okay? Iris and pupils appear normal. If you could look at my finger. All right, and then look at my nose. Look at my finger. Look at my nose. Okay, and then just look at my finger. When you come in. Pupils are equal and dilate. Curl them. Okay.
Excuse me, I'm sorry.
Oh, no, you're okay. Okay. Next, if I could have you follow my finger with your eyes. Don't move your head, just move my eyes, okay? So I'll look it to this side. And to this side. Okay, and then if you could cover one of your eyes. All right, and then if you could tell me how many fingers you see when you see them, okay? And then come up from the bottom.
2.
Okay, and then from this side.
3.
And then from the top.
2.
Okay, and then we're gonna trade eyes. We're gonna go to the next side.
Okay.
All right, same thing.
4.
Okay.
4.
Okay.
1.
Okay, thank you. All right. Next, I'm going to test you for eyesight. Okay, so we have a Snellen chart here on the wall. If you could just stand up. And if I could have you read the letters of the smallest line that you could see with one of your eyes covered.
Okay. I can see the third line up.
Okay.
HKCSCANOMPVESR.
Okay. And then if we could switch to the other eye.
Okay. That one I can see the line underneath it, the second line.
Okay.
Whoa, wait a minute. PKUSOETVXRMJHCAZOI.
Okay. All right. And then if you can have a seat again. If I could have you read just from arm's length what you can see.
I wear reading glasses. I took them off, left them on the counter. I can't really see anything on this card.
Okay. All right. But with reading glasses, you're able to see
yes, ma'am.
regular.
Yes,
okay.
ma'am.
All right. Now, the eyes appear to be normal. There are no redness around the eyes, no lesions, no drainage, no discomfort with the eyes.
No, ma'am.
No discomfort when you move the eyes.
No, ma'am.
Okay, the lacrimal glands appear to be normal. The eye is healthy appearing. The sclera is white, and the pupils are reactive and round and about a 3 or 4 right now. Okay. Now I'm going to try and visualize the red light reflex right now. So if I could have you just look straight up, look at my nose. Okay. Okay. Thank you. Okay, now I'm going to go on and I'm going to assess your ears. And they look normal right now, and they are symmetrical. The auricles are even, and the ears are symmetrical with the canthus of the eye. Do you have any pain with your ears or any sensitivity with your ears?
No, ma'am.
The pinna recoil. Ears are healthy. No swelling, no redness, no tenderness. No drainage noted to the ears. Okay. I'm going to look inside your ears now, okay?
Yes, ma'am.
Okay. So I'm going to pull up and back. Okay. The tympanic membrane is pearly white-gray, looks healthy, no drainage noted. I'm going to do several hearing tests now, okay? So I'm going to get behind you, and if you could tell me if you hear me moving my fingers.
Yes, ma'am.
You can hear that? You
Yes,
can hear it
ma'am.
in this side
Yes, ma'am.
and this side.
Yes, ma'am.
Okay, now I'm going to do what's called a whisper test. And I'm going to stand behind you again, and I'm going to whisper a few letters and numbers, and if you could just say what you hear.
Yes, ma'am.
46.
46. AB. OB. $99.
Okay, thank you. And then next we're going to move on to the Weber and Rhine tests, okay? So this is going to assess to hear if you can hear midline, and that's normal. So if you can hear the sound in the middle of both ears, if you would let me know, okay?
Yes, ma'am.
You can hear with both ears?
I can hear it the same on both sides.
Okay. And then next we're going to do both ears, but we're going to do the Rhine test, okay? And then let me know when it stops.
Right there. Right there.
Okay. And then next we're going to do the other side.
Right there. Right there.
Okay, sorry about the hair. All right. Next, we're going to move on to the nose. So I'm going to start by looking at the outside of your nose. Sorry, I'm going to move your hair. I'm going to feel the bridge of your nose. Make sure there's no sensitivities. It looks symmetrical and midline. I'm just going to palpate lightly. Do you have any pain when I do that?
No, ma'am.
Okay. Any drainage from the nares or any bleeding or discharge?
No, ma'am.
Okay. Okay. Nose appears normal, healthy, symmetrical, midline. Okay. Now I'm going to ask you to lean your head back a little so I can visualize inside the nares. Okay. No drainage noted, no deviated septum. I'm going to ask you to do what's called a nasal patency test now. So if you could just take one of your fingers and block one of your nares and take a breath in and out. And then we're going to change sides and we're going to do the other side and in and out. Okay. Any discomfort or problems breathing, taking deep breaths? Okay.
No.
All right. Next, we're going to do what is called a smell test. So I'm going to ask you to close your eyes. And if you could just tell me what you smell.
Apple.
Okay. And
Cinnamon.
okay. Thank you very much. You can open your eyes now. Okay, next I'm going to put on gloves because I'm going to look inside your mouth and check your throat and your tongue and your inner, okay?
Okay.
Okay. So first, if you could stick your tongue out and say ah. Okay, and then move your tongue from side to side. Okay, and then smile. Okay, and then I'm going to ask you to touch the tip of your tongue to the roof of your mouth. Okay, and then if you can touch the sides. Okay, and if you could. Okay, any pain or any. Okay. All right, that's kind of a funny part. Okay, and then what we're going to do next is I'm going to check to see if you have any bleeding or if you have bleeding gums or if you have any problems with your teeth, any loose teeth, and to check your tongue to make sure there's no any sort of lesions. Okay? Okay. If I can get you to stay on. Okay, there's the gag reflex. Sorry.
That's okay.
Okay, and then I'm just going to look inside your mouth. Okay, the mouth appears healthy. The buccal mucosa is pink and moist. If I could just... No loose teeth noted. If I could just go under your tongue. Okay. Thank you. And then I'm just going to be touching your tongue. Okay? I'm going to use this piece of gauze to just touch it, make sure there's nothing. Okay. Sorry, if you could just stick your tongue out. Okay, tongue appears healthy, pink, moist, no ulcerations. Okay, thank you. Okay, so now we're going to move on to your respiratory system, okay? I'm going to check the front of your chest, the back of your chest, and I'm going to be percussing and I'll be auscultating as I move along, okay? I may need to touch you for some parts of this, so if you feel uncomfortable, let me know, okay? So first I'm going to check for some lung expansion. So I'm just going to watch you and make sure that your breathing and chest wall movement is bilateral and equal. Okay, so just take normal breaths, breathe normally. Okay, and then I'm going to come around the front and I'm going to feel under your 10th rib, okay, for thoracic expansion.
Okay.
Okay, so. Okay, if you could take in a deep breath. Okay, and out. Okay, another deep breath. Okay, and out. All right, and then I'm going to go around the back and I'm going to do the same thing from the back, okay? Okay, if you could take a deep breath in. And out. And another deep breath in. And out. Okay. Now I'm going to listen with my stethoscope. I'm going to auscultate your lungs. And then I'm also going to be percussing as well. I'm going to percuss first in the back, and then the sides, and then the front last. So if I could have you cross your arms. Okay. I'm just going to be listening to your lung sounds, okay? Okay, and then I'll be doing the sides. Okay. Okay, and then from the front. And this part can be a little bit difficult, especially if the patient is obese or has large breasts. Okay, and then now I'm going to auscultate your lungs from the back, and then the side skin, and then the front. Okay. Okay, if I could have you take normal breaths.
Do you want me to cross my arms again now?
Yes, please. Thank you. Okay, and then the front. Okay. Breathing appears to be normal. No use of accessory muscles. No respiratory distress noted. Chest wall movement is symmetrical. I'm going to test now for something called tactile fronted test. So I'm going to ask you to say 99 when I place my hands on you, okay? I'm going to place my hands on you in the front, and then I'm going to go to the back and do the same thing, okay?
Okay.
And you should be able to feel like some vibrations from your vocal cords.
Okay.
So if you could just say 99.
99. 99.
Okay. And then I'll do it from the back. You could say 99.
99. 99.
99. Okay. And in kids, we have them say Mickey Mouse. Okay. Next, I'm going to be assessing your heart and your cardiovascular system, okay? But first, if I could get you to raise your arms on one side right here, okay? I'm just going to palpate to feel your lymph nodes and make sure that there's no swelling. Any pain, any discomfort?
No, ma'am.
Okay, and then we're going to do the other side. Okay, and then now I'm going to check your hands for cap refill real fast and check your pulses. Good cap refill. Okay, and then I'm just going to check your pulses. And if you could just turn your head to the side, I'm going to check for jugular vein distension. Okay, and then I'm also going to check, while I'm there, I'm going to check your thyroid, okay? All right, if I could just have you swallow. Any discomfort when you swallow?
No.
Okay, and then I'm going to do the other side. Okay. No deviation of the trachea. The trachea is midline, and no extra skin folds. Neck looks good. Okay. Now I'm going to place my hands on your chest, okay, to try and feel the heart, okay?
Okay.
Do you have any pain, chest pain?
No, ma'am. So you can actually feel the heart?
I can find certain landmarks, like the PMI,
Oh.
and that helps me determine where I should auscultate. Okay, I'm going to auscultate now. Okay, next. For this next part, I'm going to have you lie down. Okay? So now I'm just going to visually assess your abdomen, and then I'm going to be percussing, and then I'll be palpating. Okay?
Okay.
Okay. So, have you had any abdominal pain or tenderness?
No, ma'am.
Okay. The abdomen appears to be rounded softly and is flat, no bulges or abnormal areas.
Do you need me to lift my shirt, ma'am?
No, it's okay.
Okay.
You can, if you feel comfortable, you can. If you don't feel comfortable, you don't have to. Okay? For privacy purposes.
Okay. Thank you.
Okay? Thank you. All right. So first I'm going to listen to your abdominal quadrants, okay? Your vowel sounds. Okay, now I'm going to percuss, okay? So you're going to feel me tapping.
Hold on a second.
Sorry.
I'm sorry.
Sorry. Okay, and if you could just try and sit up slightly. Okay. No bulges noted, no signs of hernias. I'm going to lightly palpate and then I'm going to deep palpate, okay? Do you have any tenderness or pain?
No, ma'am.
When I press, if I get to a part where it starts to hurt, let me know, okay?
Okay.
Just breathe normally. Okay, now I'm going to palpate deeper now. Any tenderness?
No, ma'am.
Okay, and while I have you here, I'm going to check some blood pulses. Okay. Okay, if I could have you sit up, please. Okay, now I'm going to be checking your joints and your arms and your elbows and your wrists and your knees and, okay, your musculoskeletal, and I'll also be checking your spine. I'm sorry? Your spine. Okay, I'm going to start out by checking your spine, okay? If you could just tell me if you have any pain.
No, ma'am.
No pain? Okay, good. Any back problems?
No, ma'am.
Any discomfort when bending over or picking up objects?
No, ma'am.
If you could extend your arms out. Okay. Scapula are equal, symmetrical. Okay, and then I'm going to come around to the front. And if I could have you, and then to the back as well. Okay, and then I'm going to start by feeling your joints and moving your arm around. Okay, And then are you able to go at the back? Okay. And then bend at the elbow. Any problems with the wrists or the fingers or?
No, ma'am.
No? Okay. Same thing. I'm going to have you bring your arm up and then forward and then to the back. Okay. And if you could bend your elbow and any wrist problems.
No, ma'am.
Okay. And you're able to move all your fingers equally.
Yes, ma'am.
Okay. Okay. Now, for the knees, are you able to stand up? Thank you.
Sorry.
Okay. And then we're going to do a squat so I can just see. Okay. And then are you able to lift your knee up, other knee up? Able to bend over and touch your toes as close to the floor as you can get. Oh, wow. Okay. You can go down further than I can. Okay. And then next I'm going to assess your gait. So if I'll step to the side and if you could walk to the knee. Okay. And then walking is symmetrical. No problems walking. No pain with the legs or the knees.
No, ma'am.
Okay. All right. And if you could push against my hands, push down. Okay. And then push up. Okay. Okay. And then if I could push in.
Okay.
Okay. And then push out.
Okay.
Okay. And then we're going to be doing a couple of neuro tests as well. So if I could have you do this. Okay. And then if you could touch your nose with your finger. One nose. And then other finger. And then faster. Okay. Okay. All right. That's good. That's very good. All right. And then next, if you could put your feet out and then put your arms out with your eyes closed.
Okay.
Okay. All right. And then next, I'm going to try and push you over.
Okay.
Okay. So if you could just regain your balance. Okay. Okay. All right. And we can have a seat again. Okay.
Yes, ma'am.
Thank you. Okay, so next we're going to do several things. I'm going to tell you to close your eyes, and you're going to tell me where I'm touching you. Okay? So.
Left shoulder. Right shoulder. Left side of my face.
Okay.
Right knee. Left elbow.
Okay. And then I'm going to be checking some of your reflexes now as well. Okay. So just if I can have your arm and if you could just relax it. Okay. I'm going to be checking reflexes right here. Okay. And then checking on this side as well. And just relax. Okay. And I'll be checking the reflex on your knees. Okay. Okay. And then next I'll be touching the bottom. Are you ticklish?
Not really that bad,
Okay.
no, ma'am.
I'm just going to be checking the Babinski reflex, okay? Alright. Okay. And if you could push up against my hands, push up, okay? Push down, okay, and then push in, push out, okay. Do you have any concerns or any questions?
No, ma'am.
No? Okay. Well, that will be all.
Thank you very much.
Okay.
Thank you.